I've had TelScreen for, as long as I can remember. I think it's got to be at least 2 decades. You don't realize the value of it until you have it. I really have been difficult to waver from this technology, and I think there's a number of reasons why. The obvious first one is the level of resolution. I think that's something I've seen a significant differentiation when it comes to TelScreen. Things like the anterior chambers, hard to see cell and flare, with most of the camera systems. You can see it certainly with a lot of slit lamps. This is one that bridges that gap. I can easily see cell and flare in the anterior chamber. I can see the resolution within the cornea. That plays a role. The second thing is ease of use. I don't have to do a lot to get the optimal optics. They're kind of built into the system. I have my setting like everybody does with a slit lamp. I don't have to do anything more. And I'm able to see that level of quality that's there, including staining. And then finally, it's the ease of capture. You got to keep in mind, you're presenting to every single patient. It's going to apply in clinic to every single patient. And I can count on the resolution and on the videos and capturing what I want to see there, and ease of being able to capture it. And I think those 3 things are at least 3 of the things that set it apart. So many times during the course of clinic, I've had patients who, were referred over from a doc, but they didn't have a lot of symptoms. And I actually studied if it was possible to influence compliance in patients who are asymptomatic. When the patient came in who had no symptoms, I figured that I achieved compliance if they purchased a product a second time, because they could have purchased it, never used it again. So our success over the course of 6 months was if they repurchased. And what I did is I took a picture on TelScreen of the pathology, whether it was blepharitis, collarettes, whether it was dry eye patches, whether it was inferior exposure keratitis, didn't matter. I'd make it big enough in the screen that they could see it. Sometimes larger images scare people more anyway, so that's good. I would then say, a phrase that I consider pretty magical, and I'm seeing something here that concerns me. Patients get really worried when the doctor's concerned. It is a pretty amazing phrase, and patients do. They get kind of a little white, they lean forward, and then I explain, here's what you have, and if I don't treat it, here's the consequences. Eventually, you will get debilitating dry eye. You will lose these lashes. You will continue to have breakdown that's hard to fix. And we achieved more than 70% compliance. These were asymptomatic patients. But I'll tell you, without the TelScreen image, I don't think it's as effective, or even nearly, maybe even not effective at all, because until they can see a picture of their own eye and you explaining what you're concerned about, in an asymptomatic patient, they're not likely to believe necessarily what I'm explaining until I can show them their own eye. What most amazed me is how many patients would come back and say, I never realized how good my eyes feel now. They weren't even aware they had problems. They were asymptomatic, but the difference when you treat them, and that's a patient you lock in, but they never would have taken the steps to the treatment had they not seen the image of their eye on the TelScreen. I think the thing that really stands out for me is it makes practice enjoyable. I love being able to pull up an image on a patient, show them what's going on, show them the staining patterns, and show the blepharitis and the level of it. Certainly they are reimbursable. It does pay for itself, but it's the ability to enjoy that practice day as you're explaining to patients what's going on. No one likes a day when, your patients are backed up and they're complaining and they've been waiting an hour and a half, or whatever it might be. And sometimes having to explain what's going on takes much more time than the exam. When you can show an image of what you're talking about, where the lashes are, this is what's called your cornea, this colored part behind here is your iris, they're oriented within seconds. And then I can explain what's going on. They get it, they understand it, and then I can go to the treatment and move on to the next room. That also makes practicing enjoyable, the ability to be efficient and to not have to be bogged down, trying to explain things with a single patient. This technology, because of the ease of use, it's instant. It's just like having a slit lamp. The only advantage now is you've got this wonderful resolution to show the images to the patients, to be able to capture the video or the pictures. You don't have to change anything in your practice. You just found a better way to practice, more enjoyable, more efficient. I couldn't practice today without it.